Well, one of life's best gifts is the gift of having a family and making your own. But what if the time isn't right for you to do it now? Here's Alana with an idea.
Ladies, let's talk for a second. If a family happens to be in your future plans, but you're not ready for it quite yet, we have some great information for you on how you can kind of slow down the process and have a family on your own time. And here to tell us more about that, we're talking to Dr. Joe Garza. How are you?
How are you?
Very good. Well, let us know how we can slow down the process and postpone.
Well, with the new process in vitro fertilization, particularly oocyte or egg preservation, a person, if they need to because of career decisions or education, can freeze her eggs and then utilize them later on in life when she's ready to start her family. And that way she can maintain the high fertility and low risk of having a baby with Down syndrome.
I think this is a very smart thing to do, especially if you are career-oriented right now and a family just isn't perfect right now at the moment. But let's talk about candidates. Who is this good for?
Well, certainly anyone that's thinking about having a family and is wanting to do the preservation before 40, 43 years of age, because human fertility starts dropping in the early 40s. Also, the risk of Down syndrome starts increasing statistically at about age 35. So if you want to balance that and decrease the chance that you have a child with Down syndrome, then the sooner the better.
Is there an age that's too early to come in?
Not necessarily. It all depends on the woman and her particular criteria and what's important in her life.
Very good. Well, how does it work?
You usually will start taking medication to make more than one egg, which is what Mother Nature's pattern is. Then once they're mature, we retrieve them under a little anesthesia vaginally and freeze the eggs. And that way, if she hasn't married or doesn't have a partner right now, she can keep the eggs frozen until she's ready to decide on a pregnancy. Once the eggs are frozen, we can unfreeze them, fertilize them, let the embryos grow, and usually about 3 to 4 to 5 days later, transfer them to her body, and hopefully they'll implant and she'll have a baby in about 8.5 to 9 months.
If there's anybody at home that might be interested in freezing their eggs, and you could help them maybe, these last words of encouragement, what would it be?
Well, if you're approaching 40, it's better not to postpone it, because we can't beat Mother Nature. We just sort of have to coax her along. So the sooner you decide, the better chance you have of having mature, healthy eggs and a low risk of genetic anomalies.
You can find out more at the Advanced Fertility Center. They're on Hardy Oak Boulevard, Suite 500. Check the website, advancedfertilitycenter.org, or call 210-616-0680.